California's decision to expand Medi-Cal coverage to include undocumented immigrants aged 26 to 49, projected to cost $2.86 billion, has sparked debate. Rapper 50 Cent or Curtis Jackson expressed concerns on social media, questioning state-funded health insurance for immigrants while veteran coverage remains incomplete. This critique raises broader questions about budget allocation by federal, state, and local governments for populations with varying documentation status. The veteran healthcare system faces persistent challenges with long wait times and limited VA services. 50 Cent's Instagram post questioning taxpayer funds directed towards Medi-Cal instead of veteran care highlights potential gaps in how federal and state programs address healthcare needs. As California implements this Medi-Cal extension, outcomes will contribute to national discussions on immigration policy, healthcare funding models, and universal medical coverage. The expansion, covering undocumented immigrants aged 26-49, is a significant policy shift for the state's Medicaid program. Medi-Cal, which aims to make medical care accessible for over 14 million enrollees, including low-income families, seniors, and individuals with disabilities. Debates on funding allocation arise, with critics suggesting resources be prioritized for veterans' healthcare and other needs before extending state-funded coverage to immigrants. Proponents argue that preventive care for this group could yield long-term economic benefits, emphasizing eligibility regardless of immigration status. The $2.6 billion initiative has fueled debates on spending priorities and public money use, prompting questions from 50 Cent and others on why funds aren't directed to veterans' healthcare. His critique taps into broader discussions on healthcare priorities and access disparities. The U.S. Department of Veterans Affairs faces challenges with wait times, service availability, and meeting patient needs. 50 Cent implies that funds for Medi-Cal expansion could enhance veterans' healthcare access. The VA provides healthcare to millions of veterans. But long wait times, bureaucracy, and accessibility challenges persist. Efforts to address wait times have shown uneven results, impacting veterans' health, especially those with serious conditions. Accessibility issues in rural areas and bureaucratic hurdles in VA facilities pose challenges, with attempts to simplify administrative processes ongoing. Medi-Cal, since 1966, provides essential medical services to low-income Californians. The recent expansion reflects the state's commitment to healthcare equity. The ongoing national debate on healthcare policy, Medi-Cal's coverage extension to nearly 700,000 undocumented immigrants, and the $2.86 billion cost intersect with conversations about public versus private models, insurance frameworks, and healthcare as a right. Governor Gavin Newsom's vision aligns with the expansion, aiming for universal health coverage. The $2.6 billion cost, funded by state tax revenues, has significant budget implications but aims for greater healthcare equity, improved public health outcomes, and reduced pressure on emergency services. The economic impact of expanding healthcare coverage to immigrants is debated. Proponents argue it could lead to a healthier workforce and reduced reliance on emergency services, potentially saving taxpayer money. Critics worry about straining the state budget and diverting funds from priorities like veterans' healthcare, making California's choice a potential model or cautionary tale. Internationally, countries vary in their approaches to healthcare for immigrants. California's policy moves towards more inclusive healthcare access, but falls short of countries with universal healthcare. Understanding global perspectives contextualizes California's policy within broader international trends regarding immigrant healthcare. The expansion's diverse community responses range from strong support by immigrant advocacy groups to concerns raised by taxpayer associations about long-term financial sustainability. As effects unfold, community responses will likely evolve. California's expansion of Medi-Cal to immigrants is a landmark decision, prompting discussions on public fund allocation and complexities within the U.S. healthcare system. The long-term impacts remain to be seen, with stakeholders monitoring effects at various levels. Questions around funding, priorities, economic implications, and health equity will shape reactions and future policy directions.
If you liked this video, consider subscribing to our YouTube channel so we can provide you all the latest viral content.